Today is Functional Neurological Disorder Awareness Day. It's when there's a problem with the functioning of the nervous system and how the brain and body send and receive signals. Today, we're joined by Dr. Ryan Smith at St. Luke's to talk about this. And the first question I had, Dr. Smith, when you sat down was, what is the difference between this disease and MS or ALS?
Yeah, that's a great question. So whereas multiple sclerosis or ALS affect the structure of the brain, functional neurologic disorders affect the function, as the name implies.
Got it. Okay. Describe a little bit more about what this disease is.
Yeah, so maybe a good way to explain this would be if you think of your brain like a computer, okay, which in a lot of ways our brains are. MS or ALS affects the brain, the spine. You can see it on imaging tests. It affects the hardware. Whereas functional neurologic disorders actually affects the software part of our brains.
Interesting. Okay. How common is this?
It's a lot more common than you would think. So actually, some studies suggest that 1 out of every 3 patients that presents to a neurology office has this.
It's not like a blanket diagnosis. It is very specific. It's not like we were talking about earlier off camera, an umbrella diagnosis, and there's different things under it. It is very specific.
It is a very specific.
Okay.
Yes.
All right. And what are the symptoms? What can people look out for?
Huge array of symptoms can happen. Anything from blindness, weakness, numbness, seizures, abnormal movements.
What's typically the first thing that people present with and ask their doctors about?
Well, it would be that exact symptom that they're complaining of. So if someone has, let's say, abnormal movements, they would present with that.
Is it like spasms, or is it more of the numbness component?
It can be any of it.
Wow.
It's usually just one thing at a time.
Okay, and is there anybody that's more susceptible to getting this?
Women in their middle years, especially if they have a history of anxiety, depression, are more prone to this.
Okay, so middle-aged women. And what is the treatment?
The treatment, again, encompasses a vast array of things, but typically we start with maybe cognitive behavioral therapy, educating the patient, assessing their mental health.
Is there any way that people can prevent it or be proactive about it?
There's really no clinical work that's gone that far yet. I would think just if you have a mental health disorder, getting that treated and being proactive would be one of the best things.
Because that's more, you're more likely to get it if you have a mental health issue going on underneath. Okay. Anything else I'm forgetting to ask that you really want people to know about? I know today is really to raise awareness.
No, I appreciate that. I think if any patient has this, that they should know that it's okay, it's very common, and that there is help for them should they seek it. It'll something to help make their lives better and make it more bearable. Absolutely.
Okay. All right, Dr. Smith, we appreciate you being here with us again. Functional Neurological Disorder Awareness Day. We appreciate your time.
Thanks.